a short video training on applying for public benefits in Kentucky during the COVID-19 crisis. We've got an all-star selection of Kentucky advocates who have worked on public benefits for a long time, and we're really excited to put this on as a resource to not only directly impacted people, but advocates who are helping directly impacted people access these critical benefits during this global health pandemic that we're all living through. So we are going to walk through a couple public benefits, but not all of them. So just up front, want to make sure to say that there will be contact information at the end of this webinar training. If you have any questions or if you need any assistance, please do reach out to one of us and we'll try to answer your questions or connect you with someone who knows the answers. So, as I said, all-star lineup. First, we've got Miranda Brown, the outreach coordinator from Kentucky Equal Justice Center. Hey, Miranda. Next, we've got Chelsea Nickham, the SNAP outreach specialist at God's Pantry Food Bank. Welcome, Chelsea. Stephanie Langeth is joining us. She's the Economic Stability Unit Manager at Legal Aid of the Bluegrass. Hey, Stephanie. We've also got Betsy Davis Stone, Health Law Fellow at Kentucky Equal Justice Center. Hey, Betsy. And then we've got Angela Zeke, the Public Benefits and Ombudsman Unit Manager at Legal Aid of the Bluegrass. Hello, Angela. And then lastly, my name is Tyler Offerman. I'm the Food Justice Fellow with the Kentucky Equal Justice Center. So, like I said at the top, we will be covering some critical public benefits during this global pandemic. There are others, but in the interest of time, we wanted to focus in on these three specifically. So accessing healthcare, we'll talk a little bit about Medicaid and Affordable Care Act plans, talk about SNAP and accessing food, the Supplemental Nutrition Assistance Program, and then we'll talk about unemployment insurance to access benefits after losing work. So just a real quick overview. When we say public benefits, we're talking about the social safety net. So oftentimes folks think about maybe one or two of these programs, maybe it's SNAP, maybe it's Medicaid, but all of them are supposed to work together to form a net, a safety net that's meant to catch people in this country when they fall in hard times. We think every Kentuckian, whether black, white, or brown, deserves help and to have their basic needs met during a dire crisis. Anyone dealing with a dire crisis deserves to access this safety net. That's why it exists. And many more Kentuckians are being pushed into a crisis because of this pandemic. So we will dive on in. So first off, I'll hand it over to Miranda and Betsy to talk with us about getting and keeping health coverage.
Great, thanks, Tyler. So a lot has changed for Kentuckians' access to healthcare because of COVID-19. On the federal and state level, some changes have been made to improve access to care. And if you would change the slide, I would like to, so this is, I'm Miranda and Betsy's here as well. So we're both application assisters, and we'll say a little bit more in a little bit about what that means, but we can help you. And there are lots of people like us working at different agencies, and we can help you apply for health coverage if you need that help. So next slide. I want to start by reminding everyone of a few rights that you have to access healthcare. First of all, if you don't have health insurance, you cannot be denied getting it. If you want to get health insurance, you can't be denied it because of a pre-existing medical condition. And that's part of the Affordable Care Act, which is what a lot of people know and refer to as Obamacare. But that's still the law. Additionally, all health insurance plans, whether it's Medicaid or a marketplace or healthcare.gov plan or a plan through your employer, all health plans have to cover a set of 10 minimum essential benefits. So I'll say real quickly what those are. Walk-in or outpatient ambulatory patient services, emergency services, hospital care, maternity and newborn care, mental health and substance use disorder services, prescription drug coverage, rehabilitative and habilitative services, lab testing and x-rays, preventive care and wellness services like help with chronic diseases, and pediatric services. So no matter what type of health insurance you have, these should be covered. And specifically during this time, COVID-19 screening and testing is covered by your health insurance at no cost to you. And that's part of it's the Families First Coronavirus Response Act, and also that as amended by the Coronavirus Aid, Relief, and Economic Security Act, what people call the CARES Act. These laws require private insurers to waive an insurance plan members' cost-sharing payments for COVID-19 testing. And what that means is that there are no copays, deductibles, or coinsurance for you to get screening or testing for COVID-19, no matter what health insurance you have. So next slide. So we're going to be talking quite a bit about Medicaid in these next few slides. So just an overview, Medicaid is a joint federal and state program that provides free or low-cost health coverage to millions of Americans, including some low-income people, families with children, pregnant women, the elderly, people with disabilities. The federal government provides a portion of the funding for Medicaid and sets guidelines for the program. So during the pandemic, if you have no health insurance, the fastest way to get it is by filling out the Presumptive Eligibility application. Presumptive Eligibility is a temporary form of Medicaid. So as I go on, if I refer to temporary Medicaid, I'm talking about Presumptive Eligibility Medicaid. So anyone who's uninsured and under age 65 may qualify for this temporary Medicaid. There's a couple different ways you can apply. You can go to benefind.ky.gov, and that's Benefind, like find your benefit, benefind.ky.gov, or call the Kentucky Healthcare Consumer Assistance Line, which is 1-855-459-6328. And I'll be putting that phone number up several times on these slides. So during the pandemic, you can get Medicaid if you lose your job. The state has made changes to Medicaid eligibility so that this application is fast and easy and more people will qualify for it. And they'll take your word. Typically when you apply for Medicaid, you may have to prove your income, submit documents to prove your income or other information. But right now, because of the pandemic, the state agency staff have been instructed to accept your own statement as proof of income for Medicaid. And then if you get this type of Medicaid and you want to find a medical provider that accepts it, you can call 1-800-635-2570 or go to the website on the screen to find a doctor or clinic or wherever that accepts this PE Medicaid or temporary Medicaid. So also during this pandemic, no one currently on Medicaid will lose their benefits unless they enroll at their own, disenroll, at their own request or move out of state. So Governor Beshear has extended Medicaid benefits by 3 months. So if you normally would recertify your Medicaid in May, your coverage has been extended to August and you don't have to worry about it just yet. All Medicaid copays and prior authorizations are suspended during this time. So I mentioned that you could apply for temporary Medicaid on benefind.ky.gov. This is the website. And this is actually the website for applying for any state administered public benefits in Kentucky. So that would be Medicaid, K-CHIP, which is like Medicaid, but for children in families with a little bit higher income, SNAP or food benefits, K-TAP, cash assistance, child care assistance, and Medicaid waiver services. All of those applications are connected through this website. And you can actually create an account on Benefind and apply. Generally, if you were to do that, you would click on the green Let's Get Started button. and create an account. However, right now, if you pull up this website, you'll see at the top that red line, that red banner, and that can be for people needing temporary health coverage because of COVID-19. So it says to go to the bottom left of the screen under assistance programs and click on health coverage application in green, healthcare coverage application. So that's why I circled that in red. So if you click on that link, it will take you to a one-page application for temporary Medicaid. So that's the next slide. So this is what the application looks like for presumptive eligibility or temporary Medicaid. This is that quick and easy application I referred to in the earlier slide. That the social security number field is marked with a red asterisk, like it's required information. However, it's not required, so advocates in Kentucky Equal Justice Center and Kentucky Voices for Health, we've been asking the state to remove the red asterisk and make that an optional field. If you get assistance, if you get assistance with your application, whereas you don't fill this out yourself, but you get somebody to help you do it, like an application assister, we have another way that we can help you submit the application through Benefind, and we wouldn't have to include a social security number. But if you actually go to Benefind and click the link and pull this up on your own, this is what you will see. So this application does not ask for detailed income information. It does ask you if you have, it does not ask if you have health insurance, and it does not ask for detailed personal information such as immigration status. This type of temporary Medicaid coverage will last through June 30th, 2020. At least that's the current expectation. And then once you have temporary coverage through this application, then you can fill out the full application on Benefind to see if you're eligible to stay on Medicaid past June 30th. But that's a longer application. So next slide. Great. If you already have health insurance through what we call the marketplace, which is you may also know as healthcare.gov, then this may be a time for you to think about if you need to make any changes to your application. So if you don't know what healthcare.gov or the marketplace is, that's okay. If you have it, then you should know what it is. Some people have marketplace or healthcare.gov coverage. Usually if you are under 65, make much money for Medicaid and don't have a plan through your employer, this is an option for you. And the marketplace offers cost savings to make private health insurance more affordable. So that's its purpose. So if you have a marketplace plan and your income has changed, then you may be able to change to Medicaid, which is free, or to a lower cost marketplace plan. You can report an income change on your marketplace application, which you can access by going to healthcare.gov, logging in and finding your application, or by calling either of these numbers on the screen. The first number, the 1-800-318-2596, that is for the healthcare marketplace. So that's the federal call center. And the second number is the same number I showed earlier for general help with signing up for health coverage in Kentucky. Next slide. So while we're talking about the marketplace, I want to cover that these are other examples of changes you might report on your healthcare.gov application. If any of these changes happen to someone in your household, you can report the change to the marketplace, and doing so may make you eligible to change your plan or switch to Medicaid. So this is called special enrollment because it can happen at any time of the year, not just during the open enrollment period. Some other examples of changes that could cause a special enrollment are loss of minimum essential coverage. That would be like if you or someone in your household lost an employer plan or COBRA, gaining a dependent or becoming a dependent, marriage, permanently moving, being released from incarceration, a change in citizenship or lawful presence, and these are just a new payment assistance eligibility. That would be if your income changed enough to change how much cost savings you could get on the marketplace. So these are just the most common changes, but there are others, and every situation is unique. Usually special enrollment periods are 60 days from the date of the change. Sometimes you know the change is coming, then you can report the change ahead of time. For example, if you know your partner's health plan through their job is ending on May 31st, then you can report the change now, and you have until May 31st, but also 60 days afterwards to enroll in a marketplace plan or change from one marketplace plan to another one. The earlier you report a change, the more likely it is that you will avoid a gap in your coverage. So next slide, and Betsy, would you cover how people can get help?
Yeah, absolutely. So Miranda mentioned that if you want more information about, or you want somebody to help you through the process of getting Medicaid or signing up for a marketplace plan, you can get a free application assister. There's a website there that you can go to where you can pick an application assister, or you can also call the number that's there, that 1-855 number, to have somebody assigned to you. And that person should kind of walk you through the process. If you're denied Medicaid for any reason, and you think that that decision is wrong, and Miranda mentioned earlier that nobody should be terminated from Medicaid currently, that started March 18th. So if you lost Medicaid coverage after March 18th, you probably lost Medicaid coverage incorrectly. So if you think that you were denied Medicaid coverage, or you think that your healthcare.gov plan should be less than it is, like you should qualify for more cost savings than the system says that you should, you might want to start by contacting an application assister. That's free. So is the legal aid option that I'm going to talk about in a second. But that application assister might be able to get you re-enrolled or do a new application more quickly than you can appeal it. They might also give you a little bit more information about what your options are. But if you really need to appeal the decision, please be sure that you look at the documentation that you have about stopping your coverage, and make sure that you apply for that appeal in time. There are normally time limits on all of those things, and it's best if you file your appeal in that time period. But legal aid programs across the state, there's one that covers every county, so wherever you live in Kentucky, can also help with appeals sometimes. And there's a website down there, kentuckyjustice.org. And that website is going to direct you to, based on what county you live in, what legal aid program you need to call.
Great, thanks, Betsy. So many, that contact information for an application assister, that's one way to get one. There are local application assisters at local agencies around the state, at places like Community Action or health clinics, so you can always call them directly if you're already familiar with them, or you can call this 1-855 number or go to the website to find someone. So the final slide for us, Betsy and me, is information important for immigrants specifically. And I have two major points here. One is that emergency Medicaid may cover COVID-19 testing, evaluation, and treatment, because COVID-19 could reasonably be defined as an emergency. Patients can apply at the hospital or get an application at their local Medicaid DCBS office within 3 months of the emergency happening. So you don't have to apply right away, but there is a time limit. And other important coverage options for immigrants that are in place regardless of the pandemic, but could be important for you now, are that pregnant women can get temporary Medicaid for up to 2 months of their pregnancy. And pregnant women can apply through participating healthcare providers. Also, all hospitals receive federal funds, what are called DSH or DISH funds, which just stands for Disproportionate Share Hospital. But basically all hospitals have funds to treat low-income people. These are federal funds, and hospitals may screen people for this specifically, or just use the funding to screen people for their own financial assistance or charity care programs. And then also, as part of the FFCRA and the CARES Act for COVID-19, the U.S. Department of Health and Human Services will provide claims reimbursement to healthcare providers, generally at Medicare rates, for testing uninsured individuals for COVID-19 and treating uninsured individuals with a COVID-19 diagnosis. So hospitals choose to use these funds to treat the uninsured with COVID as long as these funds don't run out. So there are funding options, there's funding available to people who don't have insurance. And then the final point here is that the United States Citizenship and Immigration Services, or USCIS, has announced that they will not consider COVID-19 testing, prevention, or treatment in the public charge test against immigrants. So the public charge rule changed in February, but the rule does not affect all immigrants. Many other programs and services are also not considered as part of this rule, just to name a few. WIC, emergency Medicaid, disaster relief, and school meal programs are not considered for the public charge test. And if you are an immigrant or a service provider who serves immigrants and you are concerned about public charge, I would encourage you to consult with an immigration attorney. You can find one if you don't have one already at immigrationadvocates.org. They have a legal directory. They have one specifically for nonprofit attorneys. That was immigrationadvocates.org. And there's also more information in general about public charge and what your rights are at protectingimmigrantfamilies.org. Again, that's protectingimmigrantfamilies.org. So that is all the information that I wanted to cover.